On this channel, I've focused almost exclusively on medication. Today, I'm going to talk about the other side of um, mental health, and that is psychological input, also known as therapy. Um, Now, there are many therapies that the NHS provide. Um, these will vary depending on your um, diagnosis and what what you need. The most common in terms of depression is CBT, or cognitive behavioural therapy. Now this involves changing the way that you think, which has an impact on your behaviour. I've had CBT. The maximum sessions you're going to have are 10. So I've just got a few words of advice on how to make the most of CBT. Now you will get homework during CBT in terms of mood diaries, things to incorporate, mental routines, in terms of in certain situations, stopping and analysing how you think, and the impact that's having on your behaviour. Now, if you do not fully engage with these, homeworks, you're not going to get the most out of your CBT experience. That is part of the treatment. Granted, a large part of that treatment is with your therapist. However, it is important to state that you need to be carrying on these treatments, carry on with your treatment beyond your therapist, because after your 10 treatments maximum, your therapist isn't going to be there to help you, guide you. It's also important to be 100% honest with your therapist. If you're not, again, you're not going to get the most out of your treatment. It is important that you're not holding back during your therapy sessions, and that can be, for a number of reasons. You need to get comfortable with your therapist. Your therapist isn't there to judge you, even though it might feel like sometimes they will with their questions, but it's their job is to get the most out of you in any way they can, and that might be to ask probing questions which you might make you feel uncomfortable, but in the end that is their job. If they don't do that, they're not performing their full duties. And along those lines, it is normal that after the first couple of sessions your symptoms may be aggravated, because you are stirring up ideas, emotions that have been left untouched. Now it's not uncommon that treatment might not work for you, and that might be because you're already someone who's quite analytical about their mental health, or it could be that you are not receiving the right treatment. Now I've had CBT, I had 10 sessions, and it didn't work for me, and that's because my disorder was undiagnosed. Now I do a treatment called dialectical behavioural therapy, or DBT, and that's more focused, whereas CBT is focused on change, which has shown to be effective for depression and anxiety. DBT focuses on acceptance, and accepting your emotions and your state of being, it's almost, and it's based around an idea called mindfulness. So there's almost kind of a meditation like feel to the whole therapy process. And again, you know, with every therapy, it's important to throw yourself into that, and that's what I've tried to do. Sometimes your therapy may involve the use of group sessions. That's especially true in personality disorders, and that will involve, you know, group activities, group sharing. You know, you kind of typical idea of group sessions, although slightly different. If you are involved in a complex care treatment team, so, like I am, you'll usually just have talking therapies as well, not necessarily based on any treatment, but just talking therapies to see where you are mentally, and just to judge, again, judge your risk, which is slightly different to your standard psychological input. With complex care, it's more complex, so therefore there is a lot more input involved in that. If you have any questions, feel free to ask them. I'll answer them the best I can. It's important to mention that this is only my point of view from therapy. I'm not a therapist. I don't pretend to be, but I will answer your questions to the best of my ability. So thanks for watching. And this has been my therapy video.